BiTE antibodies or bispecific antibodies or antibodies that are conjugated to a drug or ADC, antibody drug conjugate. Certainly, we've seen some exciting results here at ASH using these kind of agents for large B-cell lymphoma. In general, those clinical trials are taking patients who wouldn't have been eligible for either an autologous transplant or elderly patients. In some cases, they're treating patients after failure of CAR T-cell therapy. What has struck me is the overall response rates are quite high. I haven't seen evidence of durability or a flattening of a survival curve using these agents. And so, and when they're used after CAR T-cell therapy, the response rates appear to be significantly lower than what was shown in the earlier trials of these agents, not being specific about any particular BiTE or ADC agent directed against CD19 or CD20 or even CD22. So I think that we'll get approvals for some of these. We'll continue to get approvals for some of these agents, but I do have concern that they will not lead to durable ongoing remissions in the way that CAR T-cell therapy does, at least CD19-directed autologous CAR T-cell therapy. And I also worry that using, in particular, CD19-directed BiTE before CD19 CAR T-cell therapy could decrease the opportunity for patients to have durable remission. So certainly these new therapies will be more accessible, they'll be available in the community, but I think it's critical that the practicing oncologist continues to think about CAR T-cell therapy very early on. In fact, in a large B-cell lymphoma patient, as soon as they've progressed or not responded to R-CHOP frontline therapy, the doc, I hope, is thinking about either second-line chemo followed by auto transplant, or if that's not working, CAR T. And if the doc's thinking that and referring the patient to a center that can do those things, the patient has a good chance of beating their lymphoma, quite frankly. But if there's delays in that referral process, unfortunately, the later a patient shows up, the more prior lines of therapy, the harder it is to get them to CAR T-cell therapy.